And we're live. Hi, y'all. Welcome to the Tuesday Live. It's great to have you here. I am your host, Dr. Dana Gibbs. I'm your local thyroid and hormone specialist here in North Texas. And tonight, what I want to talk to you guys about is 3 mistakes that a lot of people make when they're getting worked up for thyroids. So if you are suffering from worsening fatigue and weight gain, you might have done some reading on hypothyroidism and thought you might fit the diagnosis. There's a list of other symptoms like feeling cold all the time, constipated, dry skin, losing hair on the top of your head, among others that can be a really good clue. You might have even tried asking your doctor for advice or opinions or blood tests only to be told that everything's fine, you need to eat better and lose some weight. Or maybe you were even offered antidepressants, like I was. Not again. So you leave not feeling seen or validated, maybe even beating yourself up because you shouldn't feel this way if nothing's wrong, right? But it's not your fault. You and your doctor might be making these 3 common mistakes. So if you're not a physician, please keep in mind in order to make treatment decisions for individual people, sometimes physicians have to consider evidence that's not nearly as absolute as we'd like. So this is not meant to be medical advice. And you should consult your own doctor for any medical issues or diagnoses that you may have. All right, mistake number 1 is assuming your doctor, even if they're an endocrinologist, knows how to order and interpret the most accurate tests that are available for diagnosing low thyroid function. I did this for years. Even after I had graduated med school and through my specialty, I assumed that my family doctor was correct when they said nothing was wrong. I also assumed that I was properly diagnosing my own patients who would come in for thyroid surgery or for whatever else. Truth is, none of us learned, doctors wise, none of us learned these things in our training. And for all the time, I concluded that my own symptoms were just stress and lack of sleep. And they were, sort of. But it really wasn't until years later that I learned the profound physical effects of that stress were playing a huge role in making me feel like crap and worsening my baseline inability to effectively process thyroid hormones. So, along the same lines, mistake number 2 is trusting, and this is a mistake that many doctors make also, that the published laboratory reference ranges are the same as normal and that everyone who fits inside those ranges is by definition fine. And I can tell you, after 20 years of treating hypothyroid patients, this is not the case, especially without the specific lab set that I order in my practice. This particular lab set tends to out many patients who were previously unrecognized with low thyroid function. So a little lesson about lab reference ranges. So these assume, and this is for every single lab that we order from a mainstream lab, that exactly 5% of the normal people who were tested for that reference set are actually outside the normal range, 2.5 on the top end and 2.5 on the bottom end, and that everybody else who's inside those ranges is fine. And that may be okay for serum sodium, where the reference normal range varies by less than 5%. But thyroid is different. Thyroid reference ranges vary by 100% or even 1,000% in the case of TSH. And there is definitely an ideal within that reference range for the different thyroid tests. And of course, different people respond differently, but 1,000% different? Come on. So my problems certainly didn't show in the TSH test. And according to the lab ranges, even my free T3 level was normal. So why is this? Why is this so bad for thyroid? there are specific problems when you go to pick a set of folks to define the normal range. So the lab has to go out and grab a bunch of people and use them to help define the normal range. And when they grab that set of folks, there are problems when it comes to hypothyroidism. Problem number one, it's just too common. There are 15 million people walking around with the antibodies that define Hashimoto's disease, most of whom are unaware that they even have them. And two, with thyroid problems having so many vague and insidious symptoms, where the people who have them typically don't even realize that how they feel all the time is not the experience of the rest of the normal world. A lot of normal people got included. A lot of abnormal people who didn't know they were abnormal got included in the normal population when they really shouldn't have been. So when I evaluate a patient, there's a definite ideal range that we're looking for that's sometimes in the center of the reference range and sometimes just at the edge of it, depending on what we're talking about. And if you don't fall in there in that ideal, you deserve at least a trial of proper thyroid management. All right, so mistake number 3, even if you get a diagnosis of hypothyroidism, trusting that the same old treatment that everyone else gets, given the same old way, is the right treatment for you. And it frequently isn't. As a matter of fact, the standard levothyroxine treatment makes people feel worse about 20% of the time, and more is not better. And that is frequently the case even with Armour thyroid, which is admittedly is sometimes a better choice, but not always. So some doctors are trying really hard. They have noticed that sometimes people with normal labs or only slightly abnormal labs do get some improvement on thyroid treatment, at least at first, and they're willing to try. I give them credit for that. But like me, when I first started getting treated, they don't know what the exact problem is or even where to turn to get the knowledge that they need. That's where I come in. I have spent a lot of effort and time to build this specific expertise, and it turns out that there's a pretty simple add to the standard thyroid lab set that indicates right away whether the problem is ultimately thyroid related or not. So I have 15 years of clinical experience using this now, and it is right every time. And this is not really discussed in the mainstream medicine for reasons that I have discussed on this forum before. And it is frequently improperly implemented even in functional medicine practices. But when I dug into the evidence available in the research literature, the conclusion was really right there. And it makes ultimate logical sense, even if it isn't as simple as TSH in, thyroid hormone out. So the key to this knowledge is the fact that the control of our thyroid hormone function in our body does not stop with T4 and TSH in the thyroid gland itself. So for years, mainstream medicine has assumed that once you had enough T4 in your body, that your body will automatically use that correctly to activate every part of your metabolism all the time. And this is not the case for so many people that I treat. Thyroid function is finely controlled by interactions with other hormone systems like cortisol, insulin, sex hormones, estrogen, testosterone, progesterone, even how you eat and sleep and move. And when one or more of those starts getting imbalanced, it has a follow-on effect on your thyroid hormone action as well. So sometimes just fixing those other things allows thyroid imbalance to recover after a while. But meanwhile, supporting your thyroid properly in a science-based way can be key to helping those other systems recover. And of course, there are the autoimmune diseases and even genetic anomalies that push people towards thyroid dysfunction long before it's going to show up on a standard lab. All right, so what should you do instead? Yes, there are things you can do on your own. You can improve your nutrition. You can get more sleep and fine-tune your exercise regimen. And There are a myriad of thyroid support supplements out there that you can buy, but who knows what's in that stuff? I would say buyer beware there, though. Um, and have you researched what you're buying? I have met people who were taking advice from well known, self described experts in the thyroid space and spending thousands of dollars a month on supplements or coaching or both and other non standard, not covered by insurance testing and still not feeling better. So, if you've been told it isn't your thyroid, but we're given no other metabolic or hormone options to try, consider getting another opinion. You probably don't have a Prozac deficiency. If you were given other options, prioritize concrete implementation. Most of the treatments that are recommended take between 2 and 6 weeks to even start giving a significant effect. Some people get better in small increments of change. Other people have to pile several different treatments together before they notice a sudden and dramatic shift. Beyond that, maybe it's time for a change. And keep in mind what works for one person may not work for you, and that experimentation is the key to figuring out what works best. That's the case even in the hands of a knowledgeable physician most of the time. So if you're curious about what I do that's different, collect your labs and let's have a conversation. You can book an introductory call on my website, www.danagibbsmd.com. I'm based in Southlake, Texas, but I have virtual visits throughout Texas, and I'm now open in Iowa as well for virtual consultations. So that's all I've got for you tonight. Take care. The rest of your week. Talk to you soon.